everyone, this is student nurse Vince Gerald M. San Miguel, a first-year nursing student from Nueva Ecija University of Science and Technology. And today, I'll be performing Assessing the Abdomen. So, let's go! For the preparation for this procedure, first assemble the equipment and supplies that you will need in this procedure. The equipment and supplies that you will need in this procedure are first the stethoscope, the tape measure, and your skin marking pen. And provide privacy to the client, close the door, close the window. Then, ask some incidents that happened before to the client. Good day, ma'am. I'm student nurse Vince Gerald M. San Miguel. Is there any incidents that you felt before, like abdominal pain?
No.
How about incidents of constipation or diarrhea?
No.
How about changing of appetite?
No.
Do you undergo surgery before?
No.
Then, assist the client to supine position. Higa po kayo. Then, place the arm of the client's side. But if you have a female client like mine, position the arms of the client crossed in chest to lessen the anxiety level of the client. For the implementation for this procedure is the give. Greet the client, introduce yourself, verify the client, and explain to the client your procedure that you're going to do. Good day, ma'am. I am student nurse Vince Gerald M. San Miguel from Nueva Ecija University of Science and Technology, batch 24. Can I have your name, ma'am? What is your name po? And how old are you po?
9.
Okay. And in this procedure, I'm going to expose your abdomen. Is that okay, ma'am? Then, perform hand hygiene to prevent decontamination. Then, expose the abdomen of the client. We will going to use a IAPP format: inspection, auscultation, percussion, and palpation. The rationale behind this is kapag po inuna po natin yung palpation and percussion sa auscultation, iba po yung maririnig po natin sa auscultation po natin, which is not good. Then, if your patient is in pain, then if you use a palpation and percussion, it can add a discomfort to the client, so you don't have a chance to auscultate well the client. So, as I said earlier, we were going to inspect first the abdomen of the client. For the inspection of the abdomen of the client, inspect for the skin integrity of the client and symmetry and abdomen contour of the client. Hinga lang po kayo ng malalim. I-hold ko nyo for 3 to seconds. I-check ko lang po yung abdomen. Hinga po malalim. Hold nyo po. Okay. Meron po pong matigas po sa abdomen po ninyo. Wala naman po. I-check ko lang po yung abdominal girth po ninyo. Ayun na lang po kayo. Okay. Then, observe for abdominal movements. Then, auscultate the abdomen. For auscultation the abdomen, we were looking for the bowel sound, vesicular sound, and peritoneal friction rub. For ausculting the abdomen of the client, we will have 7 points where we auscultate the abdomen of the client. Starting from here to here, next to here, then to here, next to here, followed by here, and lastly to here. For auscultation for bowel sounds, we will use a diaphragm, and for vesicular sound, we will use a bell of our stethoscope. Then, before you auscultate the abdomen of the client, cover for a second the bell to lessen the discomfort that may felt of the client. I'm going to auscultate the abdomen of the mama. Then, auscultate for vascular sounds. We will use a bell. Now, at this point naman po, I'm going to auscultate for vascular sounds po in your abdomen. Also, check for peritoneal friction rub. We will also use the spot where we look for vascular sound and bowel sound. But in this also we will use a bell. Next is percussion. In percussion for the abdomen, we will determine the presence of tympani and dullness. In this procedure, we will use our 2 middle fingers to percuss the abdomen of the client, and we will have a 13 spot to percuss the abdomen of the client. So let's go. I'm going to percuss na po your abdomen. Is that okay po?
Okay po.
the percussion, now we'll proceed for the palpation of the abdomen of the client. We palpate the abdomen of the client to check for the tenderness and muscle gardening of the abdomen of the client. In this procedure, we will have a 4th spot starting from right lower quadrant. Next is to right upper quadrant. Next to left upper quadrant, and lastly the left lower quadrant. Ma'am, I'm going to palpate na po your abdomen. Then, after you palpate the abdomen of the client, proceed to palpation of the bladder. I'm going to palpate ang po yung bladder. Then, after that, cover the abdomen of the client. Then perform hand hygiene. Then document all the gathered data from the record sheet of the client. Then report for the abnormal result. Again, this is student nurse Vince Gerald M. San Miguel, a first-year nursing student from Nueva Ecija University of Science and Technology. Thanks for watching.